Good afternoon, everybody. I'm Donald Clark. It's good to see you. Pardon the light. It's kind of a challenge today. I hope all is well. And you could probably see on the title that we're going to talk about pain management, pain reduction. And so acupuncture is really great with helping with pain. Everyone knows that. That's what generally acupuncture is known for, or Chinese medicine is known for, is pain reduction. And it's great at it. It's great for acute pain, and it's great for chronic pain. And the rule of thumb in the world of acupuncture is that for every week you've had the pain equals one treatment. So if you've had chronic lower back pain for 6 months or so, it's a bunch of treatments. That doesn't apply for everybody. Everyone's a little different. So, for instance, someone might get better in 2 visits, or somebody might get better in 22 visits. I've seen both cases happen. I've had people come in, where they have it's called drop leg, where the nerve is pinched in the lower back and it affects the leg, and you have a slight paralysis. That's kind of the extreme, and it does take a few visits, and before the pain's gone, and then before you're better. So it depends on the severity and how long you've had it, and so keep that in mind. When you do acupuncture, you get a lot of endorphin release, right? So, and those are the pain management hormones in the body. And so that's and there's it's not don't get it confused with dopamine. And dopamine is the feel good neurotransmitter in the body, and they're two different things. Endorphins specifically target pain. Dopamine is more of a feel good component of all this. I'm sorry, I'm just going to close the door real quick. Sorry about that. It got loud all of a sudden. And there's other things that you can do to manage your pain too. It's so easy, and I'm also to blame for this, but it's so easy to go to the cupboard and or the medicine cabinet, and grab pain reliever. The problem is that if you are someone who has chronic pain, you're going there all the time. That's so bad for your kidneys, and it's so bad for your liver. So we need to come up with alternatives to treat pain, and that's where acupuncture comes in, or Chinese medicine. And the best pain treatment is acupuncture. I do a lot of cupping for a lot of muscle pain, but not everybody has muscle pain. Sometimes you have joint pain, right? You can't cup a joint, so you have to do acupuncture. And what we do is we do electrical acupuncture. We hook electrodes onto the needles, and it forces an electro pulse from one post to the other post. So it has to create an avenue through that stagnant, balled up tissue to work. And in order to do that, it opens up pathways for blood and oxygen. It helps muscle fibers relax. And so you get really good response from it. And another thing about acupuncture is that if you have, say, tennis elbow, and you have a tiny, tiny, tiny tear right here, tennis elbow, you have a tiny tear where the connective tissue and the tendon are starting to separate from the bone. You can actually slide a needle right in there into that injury, and that goes for any kind of muscle or connective tissue injury. A needle is so pinpoint and so accurate that you can go into the area, and you can needle it and hook electrodes onto it, and you're treating the injury directly. You're going right into the injury. It's not always the most relaxing thing, but it's the most effective. And I've treated many people this way, especially musicians and athletes. And so then that goes for any kind of tear. And so we do a lot of electroacupuncture. But you could also do it without the electricity. Some people that have seizure disorders or epilepsy or pacemakers or heart conditions, you can't play around with the electrical, with any kind of electricity, especially when you're incorporating it into their bodies properly and or prompt, I should say. So, some people aren't candidates for electroacupuncture, but most people are, and they get really good results from that. You could also treat all kinds of stuff: neck pain, back pain, ear pain, jaw pain. A lot of, I see so many people coming in with TMJ, right? TMJ is the joint in the jaw, tendomandibular joint, I believe. And what happens is we have an injury where we're eating a hoagie or something, or just we stress, we grind a lot, we clench. What happens is that joint eventually gets locked, or if you chew, imagine chewing gum for 6 days straight. That poor jaw would get so tired, and then it gets locked, and then you get a big ball of tissue and muscle, and it's all, it's horrible, and you can't open your mouth. And so what happens when you can't open your mouth? You can't go to the dentist. And so I see a lot of people that are coming here, so that they can, and it hurts horribly bad, and they need to go to the dentist, and they can't open their mouths, or they can't eat like they used to be able to. And so, you know, long story short, the pain that they have with that can be horrible. And it's a very small joint. And so the needles go right into that joint. I don't generally do electrical acupuncture on it, but it's so fine that you couldn't do it with anything else. You might be able to do it with a massage. I'm not sure if a chiropractor could adjust a jaw or not. No, I'm not sure. But acupuncture is phenomenal for TMJ. And I've been doing this a long time, and it's a rare occurrence where acupuncture doesn't help that specific TMJ pain. It always works. Again, you might need a couple of visits, but it's always going to work. And the needles are so fine and so sharp, and they're coated with a pharmaceutical silicone, so they're super smooth. There's no dragging, there's no pulling. Half the time I have to tell people that the needles are in, and not to move their fingers or their legs. They just don't feel it go in. So it's, I can't say it's painless, but it's often, you don't even know their needles are in. And then the chi, you hit the chi, and the chi is the body's energy. And that's when you start to really work with the body, and chi can get stagnant, right? Just like a pond that doesn't have a water coming in or water going out. Eventually it'll get stagnated. That goes for blood and energy too. If you have a area of the body that's knotted up and it's pain, you're not getting the flow of blood and energy like you normally would. And so the needles go in, they can help open, you go into that area, you start stimulating the chi in the blood, and you start working on the tissue, and it opens right up, and then boom, here comes the river of blood and chi and energy. And that's what stimulates the healing process, right? And it's very common for the body to want to protect itself, right? So that's why you have swelling. That's why you have muscle knots. If you have a tear, immediately, it's going to try to protect itself. That being, it's going to try to clot, it's going to try to swell, and it's going to try to protect it, to knot up. And acupuncture is just so good at that. It really is. Cupping, we do a lot of cupping. Don't let your pain go. It's very common for someone to have pain and let it go, because the reason you're able to let it go is because what happens is your body adjusts to it. So initially, when there's an injury and you have pain, everything's out of whack. But what happens is the surrounding tissue and the surrounding muscles will begin to anchor themselves to support that area. And so you don't have pain as much anymore. But then what happens eventually is that those regions start to go too, and the pain starts to spread out and it gets worse. Um, you know, pain during fertility or during a woman's menstrual cycle, very effective. Menstrual cycles can be very painful. IVF cycles can be very painful. Retrieval processes can be very painful. And acupuncture is just really splendid in helping treat that pain. If you're in a lot of pain, it's really hard to get a good follicle, right? Because you're just constantly releasing tons of stress hormones into the body. And we don't want that. And I've talked about this before. Treat your pain before you try to start your fertility journey. You need to get rid of your pain because pain is just going to hinder it. And sometimes it can get worse during this process. And we don't want that to happen at all. Take care of your pain, all right? Acupuncture is phenomenal for that. It doesn't take many appointments, especially if you've had your pain less than a month or 2 months. It's a quick, easy fix. And you don't have to constantly be on pain meds. Nobody wants to be on pain meds. But pain is debilitating, and we can't forget that. Thank you very much. I hope this helps, and I will see you guys next week.